Hello everyone, my name is Riley. I'm a first-year dental student at the University of Minnesota, and today we'll be taking a look at a rare chronic disorder known as Mikulicz syndrome. What is Mikulicz syndrome, you may ask? Well, Mikulicz syndrome is a rare autoimmune disease that affects the glandular tissue found in the head and neck. Patients with this disease present with swollen tissues mainly found in their parotid, lacrimal, submandibular, and sublingual glands. Generally, this swelling is considered painless and it occurs symmetrical, meaning both pairs of glands grow at the same rate. The swelling leads to extreme dryness of both the mouth and eyes. It is because of this dryness that patients may have blurry vision or difficulty swallowing foods. You may be asking yourself, how does one get Mikulicz syndrome? Well, as an autoimmune disease, it develops as a result of your immune system attacking your own healthy tissues. In humans, we create antibodies in our blood to protect ourselves from foreign substances. Issues in these systems can arise when our antibodies can't tell the difference between healthy and foreign cells. In the case of Mikulicz syndrome, an antibody known as immunoglobulin E attacks healthy tissues in the gland of the head and neck. As a result, patients with Mikulicz syndrome have increased levels of immunoglobulin E in their blood. Using antibody tests like an enzyme-linked immunoassay allows for a reliable way to diagnose for this disease. A similar autoimmune disease named Sjogren's syndrome has very similar symptoms but does not cause higher levels of immunoglobulin E, allowing for this distinction between the two. Both Sjogren's and Mikulicz syndrome are defined as having lymphoepithelial lesions in the lacrimal and salivary glands. Clinicians can make this distinction between these diseases on a histological basis. Higher serum levels of lymphocytes and antibodies are seen in both diseases, but higher levels of immunoglobulin E and immunoglobulin G4 are only seen in patients with Mikulicz syndrome. Mikulicz syndrome can lead to life-threatening complications if left untreated. Conditions include inflammation of the pancreas, scar tissue formation in the abdominal cavity, inflammation of the tubules of the kidneys, inflammation of the pituitary gland, and thyroid inflammation. While a diagnosis of Mikulicz syndrome may not sound great, it is very treatable. Clinical trials have proven that administration of steroids can greatly reduce swelling. It is typical to take a glucocorticoid named prednisolone at 30 to 40 milligrams a day. A study out of the Sapporo College of Medicine in Japan showed over 100% increase in salivary secretion after just 2 months of taking this steroid. Not only that, but serum immunoglobulin E levels decreased by almost threefold back to normal levels. Unfortunately, when the patient stopped taking the steroid, swelling began increasing and serum immunoglobulin E levels went back up. Because of this, patients must continue taking a smaller dose of steroids combined with an immunosuppressant. Hopefully, I was able to provide you with a brief glimpse into the world of this rare yet life-threatening disease. It is important in the dental profession to be aware of disorders like this so we can help get the patients the proper care they need right away. It may be intimidating at first, but with swift diagnosis, it is perfectly manageable. Thank you for tuning in.